Pet owners have been warned about avian flu in the GTA, but that's not the only risk they should be vigilant about. Toronto Animal Services say they've seen an unprecedented outbreak of distemper in the city's raccoon population.
If we look at the data at the end of 2022, we could see that the emergence of a raccoon distemper outbreak, which does occur every 2 to 3 years in the population.
Because of a milder winter, the virus has continued to spread throughout the season and into spring. And the number of service calls for raccoons has more than doubled.
For example, during the same period last year, we received 451 requests. This year, we've already received 1,088.
The airborne virus is generally present in the city's raccoon population and affects animals in the canid family.
It can affect dogs, and that's why we do recommend that people ensure that their dogs are always supervised, ensuring that we are monitoring our animals when they're outside, that they're not chasing wildlife or being off leash and without your control, getting into carcasses that may have succumbed due to the virus.
And most importantly, ensure that your pets are vaccinated against the virus.
It's not something that's an add-on or an extra. It's part of their routine vaccine practices.
Distemper causes raccoons to become confused or lethargic, and they may even approach people due to the disorientation.
Because they appear docile, because they are so sick and confused, people sometimes try to comfort them, and that may result in them being injured or bitten. And unfortunately, then public health has to get involved because they have to make sure that it's not rabies. And it's really, it turns into a much longer process. Even for them, they would have to go through a series of maybe prophylactic rabies vaccinations.
That's why it's best not to approach the raccoons and call 311 if you see one that may be infected. Here's the symptoms to watch for.
A lot of them will have very mucousy discharge around their eyes and nose, and some of them who have progressed a little further in the disease you may actually see them seizing. They're experiencing seizures, and typically that's why we run out. We respond immediately, trying to get those animals. Unfortunately, the virus is fatal, so we try to ease their suffering by providing humane euthanasia to most of these animals. And part of that as well, hoping by getting to them, we can help curb some of the spread of the virus.
Now, Toronto Animal Services are asking the public to be patient as they prioritize calls for sick raccoons and try to respond to them within 2 hours. Calls for the removal of dead animals could take longer because of the volume they're experiencing. For City News, I'm Dilshad Burman.